Sister Mary Frances Loftin, St. Vincent's Health System. It takes a special leader for their impact to still be felt on a daily basis long after they've left an organization. By all accounts, Sister Mary Frances Loftin was one such person. In a career that spanned more than 50 years, Loftin left a lasting legacy in the healthcare world, inspiring employees and colleagues, shaping both lives and careers, and improving healthcare access in communities around the nation. Born in 1928 in Atlanta, Loftin earned her nursing degree in 1955, but her passion for healthcare started much earlier than that.
Sister once told a story about how when she was 11 years old, she cared for her father who was ill, and she would fluff his pillows, bring him his medicine. She would bring him juice and pray with him. And she said it was then that she realized that she wanted to help those who were unable to help themselves.
That experience ultimately led her to a career in healthcare and eventually to Birmingham. She started in the industry as a nursing supervisor at DePaul Hospital in St. Louis in 1953. Just 2 years later, she made her first stop in Birmingham, a city where she would ultimately make a number of contributions to both St. Vincent's Hospital and the Greater Birmingham community.
She would have told you that she hoped that she had made a difference in the lives of patients and associates, medical staff members, and the communities where God had called her to serve. But her reach was far greater than that.
But Birmingham was just one stop in her early career. Her impact would be felt in Dallas, Austin, Chicago, and Nashville before becoming president and CEO of St. Vincent's Hospital in 1987. Throughout her career, she played a key role in developing innovative partnerships to make healthcare more accessible and affordable. It was a role colleagues said she was a natural for. It didn't take long for co-workers at St. Vincent's to spot Loftin's acumen for leadership.
I remember the first time I met Sister Mary Frances was in 1990. It was at new associate orientation. We were all gathered around the boardroom table, and Sister Mary Frances entered the room, and everyone instinctively stood up. She commanded attention when she entered the room. She was petite in stature, but her presence was anything but petite.
She led by faith and by example.
Even as a CEO at St. Vincent's, and with all the demands on her time, you could always find her on the floor, meeting with patients, talking to them about their needs, praying with them for healing in their lives. That's still talked about by staff members today at St. Vincent's.
To this day, colleagues still marvel at her accomplishments and her inspirational business style.
Mary Frances led by example. She gave 120% and she expected you to do the same. She was most often the first one there in the morning and the last one to leave in the evenings. I remember one evening I was there about 7 o'clock and there was a knock on the door, and I looked up and through the glass saw Sister Mary Frances. And when I opened the door, she said, "Rhonda, whatever you're working on can wait till tomorrow. You need to go home to your family, and let's walk out together." So Sister, in her leadership style, had this beautiful blend of fiscal responsibility along with the responsibility of caring with those who were poor and vulnerable.
Following her tenure leading St. Vincent's, she took the reins of the Daughters of Charity National Health System, the predecessor of Ascension. While leading one of the nation's most critical healthcare organizations, she ushered in several key changes, while also changing America's healthcare industry for the better.
Sister Mary Frances, during her time as president of the Daughters of Charity National Health System, which would eventually become Ascension in 1999, was instrumental in developing programs that would help groom leadership, the lay leadership, to take the roles that had previously been held by the Daughters of Charity within their facilities. So CEO roles that had always been held by a sister would now be held by lay leadership. And so Sister was instrumental in making sure that those individuals were trained and prepared to carry on the ministry. She also, during her time as the president of Daughters of Charity National Health System, served on a committee in Washington to ensure that all individuals had opportunity to have health insurance.
Ever true to her faith, Loftin made one final stop in Birmingham in 1995, where she was appointed Diocesan Chancellor for the Roman Catholic Diocese of Birmingham, the first woman in Alabama to hold that role, before moving to Mobile in 2001. It's been more than 25 years since Loftin roamed the halls as the CEO of St. Vincent's, but colleagues say her impact is still felt to this day.
She was just a tremendous woman with a tremendous love for every level of associate, medical staff members. She could relate to everyone where they were.